some of these symptoms. And sometimes I get the kid who, after I've had them 3 days, they're better. Sometimes it's 2 months or 3 months. And what we try to do is set up the environment for the healing brain, which is educate the parents, try to get sleep cycles on track, and look at other causes of symptoms. There can be other causes of symptoms that are not necessarily due to the concussion. Headaches can be from neck pain. Headaches can be from muscle issues. Headaches can be from visual issues. So what we try to do is then address the entire child. Make sure they don't have a visual cause. Make sure they don't have inner ear disturbance. And address everything and put them in the environment of repetitive physical therapy, good home environment. We try to stay away from medicines if we can. Sometimes I'll use medicines to try and get a sleep cycle back in sync and then take them away. But really, it's just setting up the environment for that healing brain. We can't make it happen.
So in prolonged situations, it'll be a consistent symptom. It won't be spotting of a variety of
That's
symptoms.
correct. The symptoms shouldn't change. The symptoms should be there, and they should either persist. Could they become more obvious because you didn't notice them right away, or because maybe somebody was a little more lethargic and had a flatter affect initially, as they start to wake up? Will you see a little more emotional disturbance that you didn't see? A shorter temper, a shorter fuse, you might see those things. But it shouldn't change. We shouldn't go from somebody just having a headache to 3 weeks later, well, now I have a balance problem. It should all be there from the get-go.
And that would be something that what we're really trying to instill is that you notice as a parent is different in your child. Why are they have such a short fuse now? Well, 3 weeks ago, I guess they were in a car accident. Maybe there is still something going on. Something where that's what we're trying to really put the onus back into that home environment, to have that seen by the parent or guardian to say, oh, this is different from what is the normal for my child. Mm-hmm. And back to your initial comment about the 2 different ways of concussions now, the new, when you had, given 3 words and then let back to go in your first instance, our education now is, as Bree had mentioned, if you get your bell rung, if you get any symptomology at all from a concussion, you're done. Practice or game. Used to be, if you had some symptomology and it went away in 5 or 10 minutes, you were maybe allowed to go back out and play. You're done. And then the next day, we resolve it the next day, then we do a better evaluation. And if symptoms are no longer apparent and everything seems to be fine, then we can start a bit of a progressive return to play outside of maybe the full management program. And if there are still symptoms lingering, then they go into a different type of a setting. But that's where the big change has occurred, I guess, in my career as an athletic trainer. I think you guys would agree, is now it's, if you have some symptomology, you were out of that contest. And that comes from all of the concerns of the longer effects, symptoms not showing up right away. That can happen a lot of times where somebody will take a hit, maybe have just a little bit of an issue, but then they don't have the full onset of symptomology until the next day. And for some people, it maybe is a little bit unfair because you can get hit in the head and just have a headache and it go away. But the ramifications of making a mistake in that regard far outweigh the person missing that practice or game in our, well, even in a pro setting. You see some of these individuals that are out there now that have the long-term effects of brain injury, that could be from one hit or multiple hits. So.
And the other thing for your own children and observing them is that we do have the ability to put them through neuropsych testing to look at their cognitive abilities. Even if they've never had an impact test, a neuropsych test is a longer 4-hour test that really looks at everything. How they think, how they remember, are they better with visual cues or auditory cues? And mostly because if they are having troubles and their cognitive function has declined, it gives us a method to help them rehabilitate. So we can say to the school, this student is not going to do good with scrolling information on a computer. This student needs to have a quiet room. He might do better if you tell him the information as opposed to making him read it. And maybe that has to persist for 6 months, but the neuropsychologist can really spell that out for a school and a parent and a child and not set them up for failure and not make them feel so overwhelmed, like, oh my God, what's going on? My life is falling apart. So I think we have that at our disposal that we didn't probably back when you had your concussion and probably 10 or 15 years ago.
Correct.
You know?
Bree, did you have additional comments?
I was, I think it's pretty standard practice that we try to tell the parents, they're going to ask for some ibuprofen or Tylenol and try to recommend that they don't do that, at least in the first 24 hours. Because if there is something else going on, the last thing we want to do is throw ibuprofen in there and cause a whole other mess of problems. But then it also lets all of those symptoms potentially manifest. It's not just, hey, I have the one symptom, but I went home and took ibuprofen right away, so the rest of it didn't come out. We try to hold them off on the medication so that we can kind of get an idea of everything that we're dealing with. Not just the headache or the balance problems, but then, my eyes hurt, it's loud in here, the noise bothers me. So I think that's something that we as the athletic trainers, it's pretty commonplace for us to say, try not to take anything at first so we can see everything that we're dealing with symptom-wise.
And there is some medical rationale between that too. If your child or your husband or whoever has a concussion and they go to the emergency room and the CAT scan is good, and they're a little off, and the ER doc says, oh, just have a concussion, you're okay, take them home, you can just watch them. Well, what do you watch for? What are you supposed to do? How do you know? And the most important thing is if they do have symptoms right then, is just give them Tylenol for the first 24 hours for any headaches or body aches. And the reason being that whole cellular mechanism again. There are some types of head injuries that people have a very loosened period and then they get worse because bleeding becomes delayed. Or if there is a mild bruise, say, on a brain that's not seen in the initial CAT scan, if there's no bleeding, something like aspirin will make that bleeding happen, and so you don't want to take that. Ibuprofen does not cause bleeding, but ibuprofen causes a little thickening of the blood, so you can get a little bit of a blood clot. So Tylenol for the first 24 hours to make sure nothing neurologic is blossoming. And you'll know if something happens, it's a big change in mental status. People will become agitated or belligerent or loss of consciousness, more lethargic. And is it okay to sleep after a concussion? Absolutely, positively, yes. But the important thing is to be able to wake somebody up. So a child, an adult, anybody, yes, take them home from the emergency room, let them sleep. It's how their brain is going to recover. But every hour or two, you just have to make sure they can wake up, know where they are, and let them go back to sleep for that first 12-hour period if it was a fairly good hit on the head. And then after that, they can sleep to recover. And fatigue is probably one of the most frustrating symptoms of concussion because the brain is trying to recover and they want to sleep. It's okay. It's okay to nap as long as they don't screw up their day-night cycles, as long as they're not sleeping all day and awake all night. If they're doing that, you have to get them to sleep all night first before you let them nap. So those are sort of the medical things right after a concussion.
Are there any other questions? Where our program is going is kind of in association with Dr. Wheeling said. We are looking to become full encompassing in regards to the therapy side of concussions, sleep issues with concussions, the vestibular balance issues, visual, all of that. And so that is where we are progressing with our program, along with the return to play, impact testing, the guidelines, and those type of activities as well. So I certainly want to thank my staff for the time that they put in into the information that they provided. I think you guys did a great job, and for Dr. Wheeling being here, and then for all of you guys being here as well. So thank you for taking time out of your evening to come and listen to what we feel to be a very important topic currently occurring with our sports and our youth athletes. So thank you very much.
Just with regards to community conversations that are upcoming, on March the 24th, 2 weeks from today, Mary, one of the outpatient nutritionists at the hospital, is talking along with Dr. Gailey. She's on call, so hopefully she can come, about bone health. Again, we're looking at bone health across the ages. Dr. Gailey has commented that she's sometimes seeing early fractures in some of our youth, and she is questioning the nutritional status of bones because of pop consumption. So she and Mary are talking about bone health. So it's not just a lecture to be for me as a postmenopausal woman. So across the ages of bone health. And then next in April, we have Dr. Berkey, who is one of the licensed psychologists at the Mind Body, who's talking about one-way relationships, living and working with the self-absorbed, related to narcissism being a growing trend. And so she's going to help us all learn a little bit more about relationships, and if we do have a narcissistic person in our life, how to understand how they feel, think, and behave, and how we can cope with those changes. So again, a really important, relevant topic, and that's on April 14th. So we'll keep you all informed for those of you that have shared emails, but thank you all for coming tonight. Thank you all, an excellent presentation. I really appreciate it. Good job.